Let's go and bring to order the District Board of Health meeting for Thursday, September 26, 2024. Can I have roll call?
Recording in progress.
Chair Dare,
Here.
Vice Chair Reese,
Here.
Mary Luz Garcia. Here. Dr. Danko is absent. John Clacking is absent. Michael Brown.
Here.
John Novak is not here. I am Jackie Lawson, your recording secretary, and we do have a quorum.
Thank you so much. Would you stand with me for the Pledge of Allegiance? Michael Brown, you mind leading us, sir?
Oh, I'm sorry, I didn't hear you.
Do you mind leading? Or Devin can.
Devin, please.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, I couldn't hear anything.
Before we begin our meeting today, I'd like to take a moment to honor someone that's been amongst us for a long time. Dr. John Novak passed away on Sunday. I call it graduated. That's my term I like to use. But a couple things about Dr. John Novak is he was a member of this board for nearly a decade, since 2015. He's our Sparks non-elected appointee. During COVID-19 pandemic, he was everywhere. Longest serving volunteer, helped with test vaccines, even with homebound program. And he was quite avid about making sure he was there for the community. He represented the Northern Nevada Public Health, National Association of City-County Officials with this NACHO. He went to all the conferences. He was also a representative for NNPH on the National Association of Local Boards of Health. Professionally, he retired from pediatric dentistry. Great man, wore his heart on his sleeve. Usually, you'd never leave a conversation without knowing what John thought or felt about that. If you had an issue, he'd let you know. But he also respected people, and he told you that as well. We're going to miss him dearly, and in our community, and in Sparks. So, with that said, can we have a moment, 30-second moment of silence? Thank you. Thank you so much. And just my encouragement to all of us is this life is short. Care for those around you. With that said, on to number 3. We are looking for an approval of the agenda unless there's something that people would like to talk about.
Move to approve.
I have a first. Do I have a second? Second. I have a first and a second. Any more conversation? Seeing none, all in favor?
Aye.
Aye.
Any opposed? That passes unanimously. Are we voting on here today?
Mine does not appear to be.
Yeah, mine's not on there either. Do you want us just to continue? Okay, we'll just continue. We're on to recognitions that come next. And before we get into our agendized recognitions, we do have a few people in the audience that I'd just like to recognize for a moment. We have guests from the Open World program, administered by the Northern Nevada International Center. Today we have, in today's meeting, we have members of the Parliament from Vietnam. These leaders are decision makers, doctors, and assembly delegates who are visiting the United States to learn more about our legislation, governance, and their policies. Please stand and be recognized. We'd like to thank you for coming. We appreciate you coming. Who knows, one day we might show up in your board meeting and you can cheer us on as well. So thank you for being here. We also have our regular recognitions and years of service. And Dr. Kingsley.
Thank you. Beginning first with years of service, I want to recognize Kelsey Atkin, registered dietitian nutritionist, for her 5 years of service. Scott Oxrott, public health communications program manager, also 5 years of service. And Stephen Shipman, Public Health Emergency Response Coordinator, 25 years. So first, I'd like to give them a round of applause. Thank you for them. So, we'd just like to recognize for the board 2 new hires, Juliet Gallardo, Human Services Support Specialist, and Alan Sanchez Ramirez, Human Resource Support Specialist. Up one promotion, Matthew McCarthy from Air Quality Management, Environmental Engineer 2 to Senior Air Quality Management Specialist. Recognized two resignations, Ian Check, Environmental Health Specialist, and Julia Davidson, Air Quality Management Trainee. We also have a retirement, Maria Rodriguez, Human Services Support Specialist, working in our WIC. She has many years here with us, but we want to recognize her and her wonderful efforts for those. So just first, again, before we move on to our health heroes, just want to recognize our new hires, our promotions and retirements and resignations, and just give them a thank you. So next, as part of our process here, that is to help recognize our employees here and the great and wonderful work that they do in our community. We have a program called our Health Heroes. And I'm going to recognize those, and then after, when we're done with this, we will come up and have pictures for all those present here today. But for our Health Heroes this month, Donna Waistcoat from CCHS for adaptability and compassion. Geraldine, I would say Yera, but Geraldine Diavila from ODHO for adaptability, compassion, collaboration, inclusivity, and trustworthiness. She went for all of them. Robert Chisel from CCHS, Adaptability and Compassion, and Jackie Lawson from ODHO for Adaptability and Collaboration. And then lastly, as a kind of a team effort, the Immunization Core Team, and just recognizing them, but Victoria Nicholson, Hornblower, Kelly Bernhardt, Kalisa Shireen, Pia Brownstein, Champagne Roque, and then for all of them for adaptability, trustworthiness, collaboration, and compassion. So thank you all for our Health Heroes. Thank you very much. And at this time, we'll go ahead and move down and have pictures.
Yeah, we have two proclamations.
You want to do the proclamations first? Yeah.
Let's do that and then do pictures with everybody.
Sounds good.
Go for it. Do you want to lead the proclamation?
No.
Okay.
Good.
We have, today we proclaim the week of September 23rd to 27th, Falls Prevention Awareness Week. It's something that none of us want to fall, so this is important. And we have Staff Representative Joe Dibble, Health Educator 2, Chronic Disease and Injury Prevention Program, accepted by Ryan Gustafson, Agency Director, Washoe County Human Services Agency. Is someone out there to accept this? Come on down. Take a moment and honor that. I feel like we've been here before.
My name is Joe Dibble. I'm a health educator too with the Washoe County Chronic Disease and Injury Prevention Program. I'd like to introduce Mr. Ryan Gustafson. Ryan is the director of the Washoe County Human Services Agency. Prior to his last 7 years with the county, Ryan was with the state of Nevada for 14 years, working with Child and Family Services. Ryan is a licensed marriage and family therapist, and in total has over 24 years of experience in service with the Washoe County community, serving the public.
Ready to go? Okay, thank you. I won't read the proclamation, but I will say thank you, board. Thank you, Chair, for the proclamation, and thank you for taking a moment to recognize Falls Awareness. The Human Services Agency wants to also take a moment to encourage seniors to stay active, to take advantage of falls prevention programs within the county. We have a senior center right across the parking lot. We have a lot of events there. We have a lot of programs there, dance classes, exercise classes. I mean, you name it. We work on falls prevention. We also partner, the Human Services Agency, we partner with the Sanford Center. They do a lot of courses. Most of those courses are free for seniors, and I want to take just 1 minute to plug one of those courses on October 7th. There's a course coming up called Healthy Steps for Older Adults. It comes with free lunch. Within that course, there's going to be screening, assessment, education, nutrition, all of those things that really ties into falls prevention and just healthy aging. So would encourage all of our seniors to take part in that. So thank you so much for the proclamation and the moments today.
So a question I have for you, for the million people watching this out in Zoom land, how can someone get a hold of you if they want more information on falls, or maybe they feel unsafe or any of that?
The easiest way, thank you for the question, Ryan Gustafson for the record. Chair. The easiest way is to quickly get on our website. You can do that from your smartphone. You can do that from your computer. You can go on to washoecountry.com/HSA. There's links there that take you to all of the places that you need to go, and also has phone numbers to get a hold of staff that can point you in the right direction for upcoming events as well.
Thank you. Did you have something to share? Please.
Thank you. Stephanie Chen, Health Educator Coordinator for the record. The Chronic Disease and Injury Prevention Program is excited to bring Enhanced Fitness to our community. Enhanced Fitness is a falls prevention evidence-based group exercise program that is tailored for older adults. We are going to be launching that program this fall in partnership with the Senior Center. It's going to be a free program for seniors, and so we're really excited to have them participate and hopefully be more active and prevent falls in the future. Thank you.
Any questions from our board? Okay, with that said, I'm looking for a motion to accept.
Motion to accept proclamation.
I do have a
Second.
first.
Second.
I do have a second. All in favor?
Aye.
Aye. We passed it. Very good. Please don't go far. We're going to come down and take a picture with you as well. And we're also here to proclaim the month of September 2024 is National Preparedness Month. And Andrea Esp, I think I saw you walk. There you are. Come on down. Bring your whole crew with you. For those who don't know, this is a very important piece of what we get to do as, well, it's not us as the health board, but it's the team, but we get to support it. And so thank you all for what you do, but please feel free to share a few words.
So with me today are Andrea S. for the record, Program Manager of our EMS Oversight and Public Health Preparedness. I have some members of our coalition here standing with us from various healthcare entities and our school district, as well as REMSA. There are also some in the audience who did not want to get up here. I would like just to thank you for acknowledging this as Public Health Preparedness Month. It is extremely important to this group, the planning and the efforts we do to make sure that our community, our healthcare community, is safe in the event something occurs. Most recently was the Davis fire. For those who probably weren't aware, we did evacuate a healthcare facility that Saturday. It was kind of a grab and go. Not even time to really tag those patients and figure out where they're going. That was in collaboration also with the RTC and the VA. So it's not just strictly those here at the health district and our community or healthcare partners. Also, part of that planning, we plan to move over 400 patients on Wednesday. That took an extreme effort among everyone that's part of our coalition. Moving over 400 patients and relocating them in our community is an extreme challenge, but that wouldn't have been possible without the group that stands behind me today. We've planned for many years on how to move patients of variety of acuity level and where to put them to make sure that their health is the #1 priority. And so this group, that's just one thing that they do. They do many things, and so I just like to acknowledge all their hard work, and it's really on a volunteer basis, and that come together and make this happen. And we really stand as a national model and have been recognized nationally for what this group does and has been in existence for over 30 years. So I'd like to thank them for everything.
Thank you. Anybody else want to share anything? Sure. I think I hear from you every year. I knew you wanted to share something.
Yeah, you knew I was. For the record, Brian Taylor, Emergency Manager for REMSA. I just want to speak on the coalition again, as I've spoke to you guys many times. This coalition is so collaborative, and in that small healthcare facility evacuation that we did, it was done without impacting the EMS system. As far as ambulances, we were able to move a lot of patients via RTC and the VA dual-use vehicle. It is going to be noticed as nationally as a best practice, the way that we do things. It has the Mutual Aid Evacuation Annex, which is the hospital evacuation plan, has been recognized in the past as a national model. And as Andrea said, we're a coalition that's been there for a long time, and it's very collaborative. And I would be remiss if I didn't just take a small minute here or a few seconds here to speak about Dr. Novak and his commitment to us. It is It was just in a champion-type role that he had for the IHCC. He attended all of our meetings. He also collaborated with us. I'm a past chair and collaborated a lot with the IHCC as well as with REMSA. And, excuse me, and I just say that, you know, we felt a great loss with his passing, and I just wanted to put that on the record. And I thank you as a board for continuing to support us, even in his absence. Thank you.
Thank you. Thank you. And I agree, it is a loss, and it's sudden in some ways, so, yeah. Any other board want to say anything? Got you, okay. We're going to take a picture, but we're going to let you guys wait a second because I see tears in your eyes. You're like, don't take a picture now. I'm sorry. Oh, that's right. We need to make a motion to pass this. Do I have a motion? Did you say second?
So moved.
Oh, so moved. No one did a first. So we got a first, second. All in favor? Aye. Aye, that passes unanimously. So we'll come down and take pictures with all. Thank you. You need any of these? I do. Thank you. I have these. Okay.
Younger than Nancy. I don't care. Oh, he just called us up.
You can stand in the back next to mine.
She's our honorary.
There we go. We'll probably have a few more there. We can get them headed up here, Andrea. We can get them headed afterwards, so. You want one for us?
All right, here we go. In 3, 2, 1. Got it? Bless us with this.
Thank you. Kaylee, is Kaylee good today? Yeah, let's go ahead and have the CCHS come. You guys want to come down? Oh, so. Yes, you're in the next one.
Donna, you can be in whatever picture you want.
All right, here we go. In 3, 2, 1. Got it.
Thank you. Thanks, buddy. Thank you so much. Appreciate you.
Now it's your turn. Thank you, guys.
5 years, Scott, you want to come up? Is someone take a picture for you? And 3, 2, 1. I can't believe it's 5 years. Kelsey Atkin? In the house, Kelsey? Come on. Steven, did you check?
No, he had a family.
All right, thanks, everyone. You have your help with us?
We have new hires. We have new hires.
Oh, I'm sorry. Come on down, brand new hire, welcome. So glad you're here. Hold your badge. I know. All right, there we go. A little more, there we go. Thanks for hanging out with us. She sent you, huh? It's one of your jobs. I know. It's just a badge. Okay, we are on to public comment. Do we have any public comment?
We do have a public comment. I'll start with, all public comment is limited to 3 minutes per person and should be addressed to the Board of Health as a whole, not an individual. With the exception of the public comment agenda items, comments will be heard for items labeled for possible action and should be specific to the item being considered by the board. The District Board of Health conducts the business of Northern Nevada Public Health and its citizens during its meetings. The presiding officer may order the removal of any person whose statement or other conduct disrupts the orderly, efficient, or safe conduct of the meeting. Warnings against disruptive comments or behavior may or may not be given prior to removal. The viewpoint of a speaker will not be restricted, but reasonable restrictions may be imposed upon the time, place, and manner of speech. Irrelevant and unduly repetitious statements and personal attacks which antagonize or incite others are examples of speech that may be reasonably limited. There are no Zoom users online today. So we will call Alexis Motorix with Nevada AGC.
Yeah, we can hear you.
Thank you, Alexis Motorix, and well done on pronunciation, by the way, with the Nevada Chapter Associated General Contractors. And I'm here today to express our support for the revisions to Chapter 030 General Source Permitting, which is item 11 on the agenda. But more importantly, I want to thank Francisco Vega and his team for always being proactive and reaching out to stakeholders to genuinely listen to our concerns, patiently answer our questions, and make changes when appropriate. Personally, I think that the Air Quality Management Division is probably my favorite public agency to work with and appreciate them very much. So thank you.
Thank you.
Very good.
We like those.
Thank you so much. Any other public comment?
No further public comment.
Very good. We're moving on to consent items. Does any of our board want to pull anything, or do we have a motion?
Move to approve as agendized.
I have a first. Do I have a second?
Second.
First and second. Any more comments? Seeing none. All in favor?
Aye.
Aye.
Passes unanimously. And we still can't push a button. Do you want us to try, or? Okay, thank you. So we're moving forward on to 8A, recommendation, regional, we have the Regional Emergency Medical Services Authority, REMSA, to come and give their update. How you doing, Mr. Duplantis? Good to see you.
Thank you very much. My name is Barry Duplantis, Chairman Dare, members of the board. I'm the CEO and president of REMSA Health for the record. I'd like to express our sorrow on behalf of the entire REMSA organization for the loss of Dr. John Novak. He was a respected, and he was certainly very respected and appreciated by all of us at the organization, and he will be incredibly missed by us. I understand you've been provided with a copy of REMSA Health's August report. August was a hectic month as we provided service to many local festivals and events that took place around the community, as well as doing our normal EMS services to the citizens within the community. For August and for the fiscal year to date, REMSA Health exceeded its franchise response compliance requirements for all Priority 1 calls. During August, REMSA responded to 8,533 Priority 1 calls, and we transported 5,294 patients to area hospitals. That was a little bit up over the prior month. And then what I would like to also say, especially with respect to the proclamation that we discussed earlier, one of the chief reasons we provide transportation to patients calling 911 is because of falls. We see it in our data, so I think it's very appropriate that we acknowledge and remind people to be careful. It's not just falling off of a ladder. It could be falling and tripping over a hose in the yard. But injury happens. So I think it's appropriate that we bring attention to the harm that can take place by falling. Our customer service survey for the month of August resulted in a score of 90.92, which was improved over the prior month. So having said that, I feel very comfortable with the performance of our service for the month of August. As we move into now the final stages of September, our business continues to track on plan with where we expected it to be. That said, I'm happy to take any questions that any of you might have at this time.
Thank you so much. Any board have any questions or concerns or thoughts? Okay. Thank you so much, sir.
Make a motion to accept the report.
I'm sorry?
Make a motion to accept the report.
I do have a first.
Second.
I have a second. And I'd say all in favor?
Aye.
Aye. That passes unanimously. And I want to say thank you for your report and thank you for your consistency. Appreciate it.
Our pleasure.
We are now moving on to 8B, discussion and possible reappointment of Dr. John Hardwick, emergency room physician representative to the Regional Emergency Medical Services Advisory Board for a 2-year term effective September 26, 2024. And we have Ms. Andrea S. begin.
All right, Andrea S., Program Manager, EMS Oversight and Public Health Preparedness for the record. Before you do have my report. This is a reappointment of Dr. John Hardwick to MSAB. Per the interlocal agreement that creates the EMS Oversight Program, the board is to appoint a representative of an emergency room physician who is also supposed to be a member of the Pre-Hospital Advisory Committee. Dr. John Hardwick is currently the chair of that committee and would like to serve an additional term on the board.
Move to reappoint.
I have a first.
Second.
I have a second. Any more discussion? Seeing none, all in favor?
Aye.
Any opposed? Good job. Passes unanimously. We're on to 9, and we are being asked to approve a memorandum of understanding between Northern Nevada Public Health in connection with the Air Quality Management Division and the Washoe County School District, and award request of proposal to Outdoor Power for the purchase of battery-powered landscaping equipment to be donated to the Washoe County District as part of the Lawn Garden Exchange. I could keep reading this, but I don't want to take your whole thunder. So it's all yours, sir.
Thank you, Chair, members of the board. Before I begin, I just want to send my thoughts and prayers with Dr. Novak's family. Although I only had the opportunity to know him for a short period of time, my life was better for it. So just wanted to say that. Now with that, it is my pleasure to present the Lawn and Garden Equipment Exchange Project. I do have a presentation.
It's up there.
Oh, there it is. There we go. I always like to start with our mission statement. Air Quality Management Division implements clean air solutions that protect the quality of life for the citizens of Reno, Sparks, and Washoe County through community partnerships, along with programs and services such as monitoring, permitting, compliance, planning, and public education. This is where this kind of project falls into our strategic plan, so just kind of want to make a quick mention of that. And then really kind of introduce some background on why this is important for air quality. I'm sure it's not the first time that I've communicated that our biggest threat to public health from an air quality perspective is ozone pollution. The biggest contributor to ozone pollution is the combustion of fossil fuels, and things that kind of fall under that are transportation, residential and commercial buildings, non-road engines, gas stations, paint, cleaners, and solvent use. The largest sector, obviously, is transportation, and we work pretty good with our community partners in trying to address that part of this issue. But there's other parts that contribute to ozone pollution, and this is one that we, I think, have an opportunity to do kind of in-house, where the rest of them, like transportation, for example, that's something that we need to partner with on the entire, community and region. So that's the issue. Now, why lawn and garden equipment? It might seem kind of odd, but a gas-powered lawnmower running for 1 hour creates as much air pollution, as driving 300 miles. Furthermore, operating a gas leaf blower for 1 hour puts out as much emissions as driving 1,000 miles. So again, that's maybe not an information a lot of people understand. So in the grand scheme of things, while transportation is the greatest sector, this is an important part of it as well. And then why schools? Children are physiologically more vulnerable to air pollution than adults because their brains, lungs, and other organs are still developing. And then in addition to that, the noise levels can be disruptive for students. So that's why we thought, lawn and garden equipment is maybe something that we can look into. Now, specifically to this project, we are extremely glad to partner with the Washoe County School District, and we're going to be proposing to replace 250 pieces of gas-powered lawn equipment with battery electric equipment. Encompassed in that 250 pieces of equipment is all push mowers at all schools. And then we try to introduce, or try to look at this from an environmental justice lens as well. So for all handheld equipment, such as edgers, trimmers, blowers, and chainsaws, we're going to replace those at all Title I schools. So again, trying to introduce that kind of environmental justice lens to this project. And then all high usage handheld equipment at non-Title I schools as well. The other thing I'll add to that is that if there's, for example, a piece of equipment at maybe one of these Title I schools that's going to be replaced, but there's an older piece of equipment somewhere in the inventory, they will replace that piece of equipment, obviously. So we're, again, really excited about that. Part of the proposal with the company that was awarded the bid is they're going to be providing 2 extra batteries for every single mower, and then also providing training on usage, recharging, and things like that. So again, we're pretty excited about all this. The total cost of the project is $247,000, and it comes at approximate cost of $988 per unit. The ultimate kind of production of the project is we will be reducing emissions by tens of thousands every single year with this project. So again, really excited about it. I think that's my presentation, but I'd like to introduce DeWitt Hadgu, who is the Deputy Chief Facilities and Capital Projects Officer with the school district, to speak on their behalf.
Good afternoon. For the record, my name is David Hadgu. I am the Deputy Chief for the Washoe County School District, overseeing the assessment, design, planning, construction, facility maintenance, and housekeeping, a big chunk of people working. On behalf of the school district, I really want to appreciate what the North Nevada Health Department, Public Health Department Board, and the Air Quality Management Division and my good best friend. Francisco
Are you
Vega.
paying people to say stuff about you?
I hope the check clears. This is the right time, actually. Our board policy and our new leadership is focused on energy saving and our environment. And in addition to what Francisco mentioned about the benefits, I just reached out to our garden and grounds and landscaping department and said, what benefits do you think that we can get out of this thing? And a couple of things that they mentioned that I want to mention to you is that the delivery of fuel to all the schools, the time that it takes, that they have to create a room specifically for the fuel that consumes a lot more, the noise that we mentioned about, and all those small things are going to be addressed by this donation. And on top of that, even though we do have the policy, but the current leadership is focusing on this thing. And it aligns with the rest of the other things that we're doing, like solar energy, the geothermal, the LED light replacement, the reclaimed water. And now, this is going to be under our byline for all the new schools that we do. We're going to provide the battery-operated equipment instead of the gas-consuming equipment. So I really want to thank the board and the members and the air quality team for doing this. Thank you.
Thank you. It looks like we have a question for Mr. Reese.
So many questions. Thank you, Mr. Chair. And I don't know if this is for Mr. Vega or to, and I'm sorry, I don't want to mispronounce it, but thank you so much for being here. So there are probably 8 or 9, maybe 10 schools where the city of Reno has joint use agreements with the schools that require our parks and recreation staff to maintain the schools. And so I just want to know how that works with those, that equipment, because it sounds like it's on a per school basis. And so can you address that?
So I do have the list, died again for the record. I do have the list of the schools, but we're going to reach out to each of the schools trying to see if we have a joint use for fields and how they're going to use it. There may be 1 or 2 equipment that we're replacing for each of the schools, not all of it. So we're going to address it as soon as we get the money and how we're going to distribute the equipment within our school system.
Awesome. So thank you so much. And then perhaps as part of my follow-up with air quality, as I'll be coming on to the air quality team this coming year, we can follow and track that issue.
Absolutely.
Any questions?
I was just curious about where the idea came from, or what was the impetus of this collaboration?
Yes, Francisco Vega for the record. So this is actually kind of a common program across the country with air quality agencies. Again, it's kind of recognized that, landscaping equipment is a huge source of pollution. So I think originally it started in, Southern California, but there's similar kind of programs like this kind of across the country. Obviously, our funding resource is small, but we thought this was a really good kind of first step, and we'll continue to look for opportunities like this in the future.
Great, and thank you for taking care of our Title I schools. Appreciate that.
So I have one, I know the answer because we talked about this, but if it's good information, what does the school district do with the old equipment? Can they move it around? Can they save it for another day? What happens we get new equipment, and are we just adding to their equipment?
Yeah, thank you for the question, Francisco Vega, for the record again. Actually, the old gasoline-powered equipment has to be essentially demolished and recycled, so it can no longer be in circulation.
Very good. Thank you so much. And I believe this is for possible action for us to accept.
Move to accept.
I do have a first.
Or approve the MOU.
Second.
I do have a second. Any more discussion? Seeing none. All in favor?
Aye.
All opposed? I think it passes unanimously. Nice to meet you, sir. Okay, we're on to recommendation to they're asking for a recommendation to uphold the Air Pollution Control Hearing Board's recommendation regarding the appeal notice violation number AQMV 240018.
Mr. Chair, unless the board requires a presentation, I'm prepared to make a motion.
I think we need to hear from him first. I think. Do you want to give?
Move to approve.
We got a first, do I have a second?
Second.
Second, any discussion? All in favor?
Aye.
Aye. Very good. Not that we don't want to hear from you, but that was good. Okay, on to 11, and it's still you.
Quick question, sorry. Who was the motion on that?
Mine was the motion,
Okay, thank
Mr.
you.
Reese.
Thank you.
Very good. And so now we are on to a public hearing. I do know that, but we will open that up once we discuss a few things. We have public hearing for review and discussion and possible adoption of the proposed revisions by District Board Health Regulation governing air quality management. Go for it, Francisco.
Thank you, Chair, members of the board. For the record, Francisco Vega, Director of the Air Quality Management Division. I'm actually going to go through this pretty quickly because it is similar information that was presented last month as part of the business impact statement. So obviously just read our mission statement, so you probably don't need that. Strategic priority again. Background on Chapter 030. Again, this is really in regards to our stationary source part of our regulations, and that's what we're looking to update. A lot of this has not been updated in 20 plus years. So some background there, why I already explained, outdated, incorrect in a lot of areas. Structure is weird, so we're looking to fix it. Major changes, as I discussed last month, one of the major changes is that we're going to be increasing that permitting threshold from 0.365 tons per year to 5 tons per year, which kind of reduces that burden on small business. So we're pretty excited about that. The other part of that is that these facilities that drop out in that threshold below 5 tons per year, again, we're just not seeing the air quality impact. So that's why this is important. Definitions, we are introducing a general permitting program, so that's something we're excited about as well. And then the other part of that is our fee structure, which again, better aligns our services where the air quality risk is. Structure, this is a far more transparent structure where again, the different parts of the regulation are broken up into the permitting program. So again, if I'm a minor source, I go here for my regulations. If I'm a major source, I go here. So far more transparent and far more streamlined. The fee changes, again, I went pretty good depth on this last month, but I'll entertain any kind of questions. Again, did significant stakeholder engagement through this process. We heard from AGC, but they were only one of, again, probably a handful of agencies that I was able to meet with. Timeline, I think I mentioned last month that 2024 is up there, but again, this has been like 2 to 3 years in the making. And then today we are at, rule adoption. Went through that pretty quick, but I'm happy to answer any questions.
Before we go to our public hearing, is there any questions? Okay, I'm going to go and open it up for public hearing. Anybody in the audience that would like to come up and make a comment or, okay, I'm going to go ahead and close public hearing. Coming back for a motion.
Mr. Chair, I'll move to adopt the proposed revision to District Board of Health Regulations governing air quality management, Chapter 30, source permitting with associated changes to the air quality management fee table with an implementation date of January 1, 2025.
I do have a first. Do I have a second?
Second.
I have a first and a second. Any more discussion? Seeing none, all in favor?
Aye.
Aye. That passes unanimously. Good work.
Thank you.
Nice.
Good work. Moving on to 12, presentation and possible acceptance of the annual FY24 Health Equity Plan Report. Camarina Augusto. Hope I said that right.
No, I was just saying Devin's a fast reader.
He is the best. Hello. Welcome.
Good afternoon. I'm Chair and members of the board. My name is Camarina Augusto, and I'm the Health Equity Coordinator here at Northern Nevada Public Health. And today I'll be presenting on the Health Equity Plan Annual Report for fiscal year 24. Is there a clicker?
Clicker's right there next, yeah.
Thank you. Okay, so before I jump into the annual report, I do want to provide some context and background on the assessment and the plan. that our organization implemented. So back in September of 2022, our organization, in collaboration with our internal health equity committee and an external consultant, decided to implement the first ever health equity assessment here at NNPH. And that assessment was really to get some baseline data to see where our organization is with equity work, but also our capacity. And so the assessment we selected was the Bay Area Regional Health Inequities Initiative, known as BARHI, and that assessment eventually resulted into an internal health equity plan. So the health equity plan comes from the results of the assessment, and it includes 7 overarching goals. So goal 1 is focused on building health equity competency among staff, so that's really providing training opportunities. Goal 2 is to ensure capacity to integrate health equity into all of our programs. Goal 3 is making sure that we're continuing to build partnerships with diverse communities to improve public health initiatives. Goal 4 is to ensure access to culturally and linguistically appropriate public health information for our community. Goal 5 is focused on data, so collecting and leveraging equity data to inform program development and also decision-making efforts. Goal 6 is to integrate health equity efforts into organizational development. And then the last goal in the plan is focused on improving hiring practices to recruit and retain a diverse workforce that represents the communities that we serve. So the health equity plan does run on a fiscal year timeline, and year 2 took place in fiscal year 24, which is what I'll focus on for today. So this timeline provides a high-level overview of when this work started and where we are currently at. So as I previously mentioned, the assessment was completed back in 2022, and that is also when the plan was developed. In July of 2023, we completed the first year of the plan, which took place in fiscal year 23. And then last month, in August of this year, completed the annual report for fiscal year 24. And then we're currently developing and building out that last year of the plan for fiscal year 25. So now I will be transitioning to the annual report. So our annual report, it reports on the progress made for each initiative in the plan, and we use a color coding system to track that progress. So each initiative is either given a green, yellow, red, or blue indicator, and that informs us if the initiative was fully achieved within the fiscal year, partially achieved, not achieved, or it did not yet start. So the annual report included a total of 24 initiatives. In the bar graph on the slide, it kind of breaks down how many initiatives fell into each of those categories. So we're really happy and excited to announce that 92% of the initiatives were either fully or partially achieved. And then there were only 2 initiatives that we did not get to in the fiscal year 24. So 16 of our initiatives were fully achieved, and I'd like to highlight a few of those. Starting out with training, so we had 132 of our staff attended diversity, equity, inclusion, and cultural competency training. We're really happy with this response because so far a lot of our trainings have been on a voluntary basis. And as you know, our organization also has a community health improvement plan, and so we've really wanted to apply an equity lens to that. And so making sure that we're partnering with community-based organizations and leaders to specifically include initiatives that address health disparities. As part of our language accessibility efforts across all divisions, we were able to translate 43 priority and public-facing documents to reduce language barriers for Washoe County. We've also completed 4 cross-divisional equity projects with internal divisions and external partners. So that could look like one of our divisions working with a health equity team, but also a community partner to move an equity initiative or project forward. And then lastly, Truckee Meadows tomorrow in fiscal year 24, they published a community dashboard with key community health indicators. So this is making sure that community health indicator data is available and accessible to our public in a way that they can understand and utilize to move forward with their own work. And that community dashboard was inspired by our organization's community health assessment. We had 6 initiatives that were partially achieved, and so what that yellow indicator represents are efforts that have made progress but are still underway. So an example of this is our organization is working towards implementing an equity framework among all of our programs and divisions to make sure that they can evaluate their work through an equity lens. And so utilizing an equity lens, what that means is that staff are able to analyze the impact either of a policy, a practice, or a decision on underserved populations and groups. And so this is work that we have kicked off and have started, but is underway, and we look to continue into fiscal year 25. And then lastly, there were 2 initiatives that we did not yet start. Those initiatives really focused on data as well as improving hiring practices. Since the completion of the annual report in August of this year, that work is currently underway and will also be a focus moving forward. So to wrap this up, looking ahead of what's to come, so we are currently building out and beginning to implement the final year in year 3 of the Health Equity Plan. And so what you see here on the screen are a few focus areas that we met with our internal health equity committee on of what they would like to focus on for fiscal year 25. And so I would just like to highlight a few of those. One of them being training. So staff really want more training on how to help tackle their personal biases, or if you are put in an uncomfortable situation, what are some ways that you can respectfully respond to that. Also continuing to implement the county's language access plan. And then one of the other focuses will be around data. So making sure that we're collecting data that not only is helpful for staff, but is also data that the community is interested in and wants to know more about. And then lastly, with staff continuing to apply an equity lens to their work, we're anticipating to see an increase in quality improvement projects to ensure that our programs and services are as equitable as possible. And that concludes my presentation for today, and I'm happy to take any questions.
Thank you for the work you do and for your presentation. Any questions, thoughts, concerns? Mr. Reese.
Thank you, Mr. Chair. Thank you so much for the excellent presentation and for the work that's going into this. I think this is one of the perhaps most important but perhaps undervalued things any organization can be doing with the resources we have. So I'm really very encouraged by the work that you're doing. A couple of things that stood out to me. One is I think that with regard to the comment you made about increasing training for staff about implicit bias. You know, we have some great resources, and I can just think of the University of Nevada, Reno, for example, who is doing good work in this area, and I have gone through their training a number of times now over the last couple of years. It seems to be very accessible, meaning it is accessible to the employees, and so perhaps there's a way for you to look in to see what they're doing. I know there are lots of good organizations, and I'm sure you have a read on many of them. This just happens to be one that's here close to us, and so perhaps there's some synergy or symbiosis with that. The second thing is, and I suppose this goes to something that I am particularly interested in, which is maternal health and child mortality as it relates to people of color. And this is just sort of a national conversation that implicates health outcomes. And I just think I would like to see that as maybe a subset of one of the data points to be looked at and to figure out where we are as a community about dealing with these issues. I know that Dr. Bayo Curry-Winchell is one of the leading experts in this area, and also, again, just something that's here local that I think is an important element of the health equity lens. I also will comment that I appreciated the earlier conversations from Mr. Vega's department talking about health equity, and so when you start to see the work you're doing and it makes it into the other departments, that tells me we're on the right track. So kudos to you for seeing it as a fully integrated process and being able to deploy some of those data points into those areas, because when you start the conversation, then it works its way into the other divisions, and then we're really cooking with gas. So thank you so much for that, but outstanding work and really fine presentation.
Thank you. Thank you for your comments.
Thank you, Ms. Augusto. I wanted to know if you could elaborate on the TMT community dashboard. Is that a new feature that they added this year? Has it been already uploaded to the website?
Yeah, so Cameron Augusto for the record. So it is up and running. And what's really important is with the community dashboard, you want it to be live in real time and updated. And so our organization does the community health assessment every 3 to 5 years. And so we're making sure as those community key health indicators are moving, that we're also updating the dashboard so it has the most up-to-date and relevant information. So that is something that is currently live and can be found on the Truckee Meadows Tomorrow website.
Okay, thank you.
Very good. Well, we are looking for a motion.
Move to accept the annual FY24 Health Equity Plan report results.
I do have a first. Do I have a second?
Second.
First and second, any more discussion? Seeing none, all in favor?
Aye.
Aye. That passes unanimously. Thank you
Thank
so
you.
much. We have 3 presentations. She's going to overachieve by Rayona Lavoie. And come on down. Our first presentation of possible acceptance of the Northern Nevada Public Health 2024 to 2026 Quality Improvement Plan. The floor is yours.
Thank you, Chair. All right, good afternoon, Chair and members of the board. Today I'm going to present information on our quality improvement program. I am Rihanna Lavoie. I'm the Director of Programs and Projects in the Office of the District Health Officer's Office. I'm going to use quality improvement and QI interchangeably today. But the purpose of quality improvement in public health is to enable adherence to best practices and to enhance the effectiveness and efficiency of organizations. As such, NNPH's QI program is designed to uplift the organization's mission to improve the quality of life of those in Washoe County by identifying opportunities for improvement, implementing changes based on data, and measuring impact in the community. QI is a requirement to be an accredited health district because it ensures organizations are relevant and viable through continuous improvement. The QI continuum that you see here up on the screen is adopted by NACHO's the National Association of County and City Health Officials, so NACHO, as all of you probably know it. It illustrates where along the culture spectrum health districts are in terms of their usage and familiarity with quality improvement. And the goal is really to move up the scale from whatever starting point the baseline survey data established to progressively higher stages. So with that expectation in mind, the team revived the QI program by asking employees to complete the NACHO's QI culture survey to understand the team's perception of 6 elements that create a thriving culture of continuous improvement. And these elements are staff empowerment, teamwork and collaboration, leadership commitment, customer focus, QI infrastructure, and continuous QI process improvement. And so generally, NNPH fell between phases 3 and 4. The 2 areas that staff and leadership perceive to be going well in support of QI are staff empowerment and collaboration. For example, staff feel empowered to provide input and initiate conversations with their team about areas to improve within their fields, which are 2 core elements of fostering a culture of innovation. Across the strongest points from fostering a culture of QI that clearly came through from staff and senior leader surveys, the lowest scores were given to anything having to do with formal QI policies or procedures. So prior to this, NNPH has not had a formal QI framework to define what is QI or the structure to determine when would be a good time to initiate a QI project, especially projects informed by our performance data. So while informal conversations are certainly happening, NNPH needed a unifying QI framework to best ensure that the organization focuses on effectively using data to drive improvements and to measure our outcomes. So altogether, the findings help the QI Council form a vision and a way forward by creating a plan that provides a framework that supports continuous improvement in programs, processes, services, and that will help us drive the organization forward. The plan includes 4 overarching goals that foster a mindset where NNPH staff are committed to identifying opportunities for improvement, implementing changes based on evidence and data, and evaluating the impact of those changes. Certainly, this QI plan is not going to replace the informal improvements that are already occurring in the conversations that are happening through brainstorming. This is supposed to supplement it through daily workflows and team expectations. So let's talk about the next steps and where we are today. Earlier this summer, all NNPH senior leaders and the QI Council attended an all-day training by a notable consultant through the Public Health Foundation to learn how to build a culture of continuous improvement. And to follow, the team is now looking into opportunities to leverage the use of metrics that we're already collecting through our performance management system, ClearPoint, and identify areas where we can increase implementation of QI efforts. And with that, I'll take any questions if you have any.
Any thoughts or questions? So the only one for me, and I think it's a lot of these things, we do a lot of work, and you do a lot of work collecting data, do all this, and maybe you're the one to answer this a little bit, Dr. Kingsley, but how does it actually go from where you're at? And I only say this just for all those people, millions of people listening, that, and then also in my own brain, how does it directly correlate down into the everyday job that we do?
That's a really great question. So quarterly, we utilize the performance management system, ClearPoint, and we are tracking all of the outcomes and our program activities through that system. That system is there to help us make informed decisions about how we should improve activities. So this could be, I'll take the Community Health Improvement Plan for an example. This could be, we want to make sure that we are implementing at least 80% of our activities within the preventative health behaviors domain to ensure that we're driving that work forward. And so we're working hard with our partners to make sure that those activities are accomplished. So that's one thing. If those things are not happening, it gives us an opportunity to lean in and say, well, why aren't these activities being implemented? We do that at the end of every year. We create an annual report, which I bring to the board to look at. So that's one example on how we do this. So we're trying to streamline the data that we're already collecting in our performance management system. We meet with the board for the strategic plan retreat. We talk about strategic plan priorities, and then all of our divisions, our division directors, their program staff are taking a look at what those actual program activities are going to be that we execute. So QI is happening through all of the things that we're doing at NNPH. We're formalizing that by making sure that we have a formality around the conversations that we're having. A lot of brainstorming is occurring. I think that you've heard a lot of quality improvement that's going on in the Air Quality Management Division. Now we're just putting some structure around that.
Thank you. Thank you. With that said, I'm looking for a motion.
Move to accept?
Second.
I have a first and a second. Any more discussion? Seeing none, all in favor?
Aye.
Passes unanimously. Thank you. On to 14. That is the presentation of possible acceptance of the FY24 strategic plan results.
Thank you again. So good afternoon. Rayana Lavoie, Director of Programs and Projects for the Office of the District Health Officer. In your board packet, you have 2 reports that cover the details of NNPH's fiscal year 24 strategic plan results. In this presentation, I'm going to share the time with our division directors to talk about the actual results to give you some context about what we've achieved and some of the challenges in fiscal year 24.
Uh-oh.
Here we come.
Good afternoon. Jackson Tino, Administrative Health Services Officer. So I've got 4 slides, and I'll go through them at lightning speed. Just a couple things that speak to accomplishments. Under Division Goal 5.3.1, increased workforce capacity. So we expanded remote work with staff, so we're up to about 83% of staff within the department that have filled out the flexible work schedule paperwork, so they have some flexibility inside their schedule, and the intent is to give the workforce coming up into this generation coming into the workforce some opportunity for flexibility and those things that they look for in work. And then 5.5.3, sure technologies or needs are addressed by the health district, technology resource, or county technology services. So we implemented new technology in CCHS. So that was really just the update for the aquarium as we expanded out our footprint in CCHS. And we also, we're currently in the process of rolling out Windows 11. So doing all the things we need to do to make sure that staff are empowered to, from a technology lens, to get all their work completed. Under 6.1.1, increased dedicated public health funding to support Washoe County Health District. So we've got some additional funding from the state this year and the previous year. SB 118, we got kind of a one-shot appropriation, and it was some expectation that we can go back to the legislative session next session and see if we can get some additional funding or maintain that funding ongoing. We've found some efficiencies inside of our budget. We've streamlined where we could. We've stripped out a lot of the excess that we had around COVID and streamlined our operating costs. Some of those places where we felt like we could trim out, we've trimmed out to make ourselves as efficiently as possible, operate as efficiently as possible going forward. And then we implemented new fees for air quality, CCHS and EHS. CCHS was implemented in January, and air quality and EHS just started July 1st, so we're still collecting data on it. A couple challenges under 5.1.1, create a positive and productive work environment. The challenges that I just listed were around Corn Ferry. It took a lot of staff time to get that implemented, probably to the tune of hundreds of hours. We were delighted that it's there. It's definitely needed, but it was definitely a challenge for us to work through the process. Under 5.5.3, assure technology needs are addressed. Workloads, some of that is starting to ease out. We've got Gloriana on with us full-time now as of July 1st. COVID is starting to fade into the background, so as that infrastructure is kind of stripped out, we have more time to focus on day-to-day stuff. So we think we're probably in good shape with TX capacity for at least the immediate future. Under 6.1.1, increased dedicated public health funding to support Washoe County, really the health district. We've seen a lot of budget reductions and a number of grants. Most things are trending downwards. There's not a lot of light at the end of the tunnel at this moment. We've got a lot of expenditure pressures that are hitting us, salary, overhead, inflation. Those things are pretty relentless at the moment, so we're doing what we can to navigate that moment in time. So I'll stop there.
For the record, Francisco Vega, Director of the Air Quality Management Division. Accomplishments, first one was monitoring of criteria pollutants exceeding 96%. The only thing I'll add there is that the standard is 70%. So just to kind of put that 96 kind of in perspective, again, we're far exceeding the standard. And we're also far exceeding the number of monitoring stations we have. We have the requirement is 2 within our region. We have 7. So, and we have 2-3 full-time staff maintaining all of that equipment. So we're exceeding the amount of monitoring stations, but we're also exceeding the amount of data collection as well. So really proud of that effort from our monitoring team. 95% stationary source permits and building plans issued, reviewed within a prescribed time frame. Again, this is something, another thing that we're very proud of. We try to be good stewards of economic development, so anytime that we get applications, we pride ourselves, again, to make sure that we turn those things around as quickly as possible so the companies can do what they need to do. So the fact that, again, we're able to meet 95% is something we're very proud of. Completed update to chapter 020 air quality regulations. We just updated chapter 030. This is something that we're going to continue and I'll bring in front of you as the months go by. A lot of our regulation is really outdated. Again, I mentioned that some of it has not been changed in over 20 plus years. So we did chapter 020 last fiscal year. We're doing chapter 030 this fiscal year. And again, we'll continue to update and make sure our regulations are reflective of our community and help us protect air quality. The other thing I wanted to mention there is we did this while also continuing and completing other large projects. Earlier this year, we had a presentation from one of my staff on the exceptional events demonstration package that we had as a result of fires from 2020, 21, and 22. That was a huge effort. I think I'm trying to think of the number, but it was like something like 400 or 500 hours worth of staff time. So, you know, yes, we accomplished it, but that was also in addition to other things that we accomplished. I know the slide says challenges, but I like to look at them as opportunities. Regional land use, planning, infrastructure decisions. We, again, welcome the opportunity to work with our jurisdictions to look for opportunities to address their goals and challenges while also maybe mitigating whatever air quality issues there may be. So as opposed to maybe being on opposite sides of the spectrum, seeing if there's, again, that we can accomplish both goals at the same time. So again, we look for the opportunity to work together and collaborate on those efforts. And then Acela barriers, we try to leverage technology as much as we can. Unfortunately, Acela, from an air quality perspective, will not allow us to accept electronic signatures. So we welcome, again, the opportunity to look for software that will help streamline the submittal process for our customers. So again, I know the slide says challenges, but again, we look at those as opportunities. Thank you.
Good afternoon, Lisa Lottridge, Division Director for Community and Clinical Health Services for the record. CCHS has had many accomplishments over this last fiscal year. Under District Goal 1.3 and Division Goal 1.3.2, CCHS expanded the role of the community health worker. Community health workers continue to be invaluable to CCHS. They facilitated an MPH becoming a mobile harvest site. This event occurs every Tuesday of every month, and our participation just continues to increase with this activity. Community health workers are now trained as PrEP navigators, helping to enroll and facilitate getting clients started on HIV PrEP medications and then following them. Division Goal 1.3.3, provide efficient and effective and culturally sensitive services. The reconfiguration of the lobby facilitated the centralization of clerical services. Staff cross-trained to allow for immunizations, family planning, and sexual health clients to be served by any clerical staff member. The goal of centralization was to improve workflow and the customer experience. This year's back-to-school clinic showed efficiencies through having more windows open and more staff available to serve clients. An additional accomplishment related to this goal includes that 18 CCHS staff members completed the interpreter certification course. Next, District Goal 6.4 and Division Goal 6.1.3, maximizing revenue generated through cost recovery. The commercialization of the COVID vaccine has brought the potential for increased revenue, along with significant changes for both the immunization team and the billing team. The immunization team navigated purchasing the COVID vaccine for private pay clients and implementing the bridge program for uninsured and underinsured clients. Commercialization also led to the need for staff to check eligibility for each client to determine their pay source, and this resulted in an increase in claims for our billing team. Additionally, CCHS started billing for select community health worker services activities and plan to expand these activities that we are billing for in this next fiscal year. We also increased contracted insurance companies. We went from 10 to 12. The 12 contracts that we have allow CCHS to bill most insured clients that come through the clinics. Oops. There we go. Okay, District Goal 1.2 and Division Goal 1.2.2. These are challenges, but I like Francisco's opportunities. So areas of challenges that we saw in this last fiscal year, congenital syphilis cases continue to rise, seeing a 340% increase from 2018 to 2023 in the number of congenital syphilis cases. Themes among cases include inconsistent prenatal care, polysubstance use, and a lack of testing at touch points for cases, such as emergency rooms. The sexual health team continues to work with community providers to promote education and testing, and are moving to a point-of-care testing in our clinic, hopefully to pave that way that when they come in, they can know their status and actually be treated before they leave the clinic. And then we hope to share that information in the community to maybe get other community agencies on board with that. District Goal 6.1 and Division Goal 6.1.3 is another area where CCHS saw challenges. CCHS had decreased and delayed grant funding throughout the last fiscal year. Several CCHS programs experienced a decrease in grant funding, which impacted staffing and service delivery. One example is the sexual health program. There was a supplemental funding allocation for 5 years, and this funding was ended 2 years early due to the federal clawbacks. This resulted in the loss of our health educator coordinator position. The loss of this position has hampered education and outreach activities for the sexual health program. This position was conducting health education, outreach, some media, and other activities to promote integration of HIV and STD into subprograms. Another example is WIC. Due to the federal budget not being finalized and a series of continuing resolutions, the WIC program did not have a fully executed grant award. And I believe it was May when they finally got that, which was disruptive for much of fiscal year 24, impacting vacancies that needed to be filled. And this led to challenges with staff coverage, client scheduling, and difficulty in maintaining and increasing participation levels.
Yeah. You're gonna have to pause.
Robert,
Oh, we did lose we're gonna lose our quorum for a minute. Let's go ahead and take a minute recess, and we'll be back. It's all good. Bio breaks are necessary. No,
Little kitchenette,
there's one way up there.
all the way up there.
Okay.
We'll let you take a seat. So. All right. Good afternoon, board members. Robert Fida, Director of Environmental Health Services. So I wanted to highlight some of EHS's accomplishments as well. And a lot of it has been kind of leveraging some of our opportunities. The idea we wanted is we're wanting to improve our customer service and functionality of Acela so that way clients can get better access and easier submittal information for whatever they need in terms of environmental health services. EHS and air quality, we've invested significant resources in kind of revamping some of our Acela tools. And a lot of that investment, staff capitalized on that. So while we're going through this process, they were looking at ways to streamline processes internally, consolidate stuff, and make data reporting better as a final product. We're still working on that. So we're hoping that the final product that we push out will be something great for the community and that it'll improve our ability to provide permitting information using the One Nevada digital platform. So the other accomplishment we had is as we went through our fee schedule this year, staff identified opportunities to kind of maximize revenue as well as increase some of our cost recovery. And one of those things was the creation of the new annual itinerant permit. I've mentioned this before, but a lot of our annual itinerant folks that attend these events, they tend to do a lot of repeat work. So a lot of these folks are receiving 6, 7 inspections a year because they attend different events. The creation of this permit is designed to kind of reduce some of that staff labor while still maintaining public health goals and provide some value to the customers in the community. And then another one of our accomplishments is a lot of, I'm proud of the work that our staff do in terms of education and outreach. Our food program has been kind of piloting the active managerial control program. They've actually been collecting data as well. I've been looking at some of the preliminary results, and it shows some promising, it shows very interesting and promising results on some of our educational outreaches. And then also our safe drinking water is very connected to the community, and they've been conducting outreach on some of the new federal regulation changes, specifically the lead service line inventory that is due next month. So some of the challenges we've had is a lot of it is related to staff turnover, and there is limited capacity to kind of train staff. About 2/3 of our staff has less than 5 years experience in the field, and about 40% of our staff has less than 2 years experience in the field. And so with turnover, in order to become an REHS, there's a significant investment, about 2 years of training, and then after that, we will kind of move them. As time progresses, there's efficiencies and more cost recovery as the inspector stays longer in the role. We've been seeing higher turnover. We have a lot of successful staff. Our staff members have kind of moved on to, I was going to say, I guess, a lot of our staff members move on to other public health fields. A lot of them go to the FDA, and so we've had our staff are very talented, and they move on to other jobs that allow them to kind of fit more in line with their personal and career goals. So, but that is kind of one of our challenges, is we do invest a lot of time and energy in staff, and we do not always get that return on investment. So as you can kind of see on some of the data I've proposed, that is kind of the distribution of experience in the staff. The other challenge, or as Francisco mentioned, is opportunity, is essentially Acela. Acela is a great tool, but there are some constraints as well that we have to navigate. And some of that is obtaining data through different processes and how to kind of streamline processes that aren't quite within our control. So some of it is the building process, I guess, would be the easiest example. We work with each of our jurisdictional partners. We try to work inside their processes, but there are subtle nuances between each process, and trying to navigate each one independently makes it a little bit challenging for staff. And that's kind of what I have, and I'll pass it on to Dr. Dow.
Good afternoon. For the record, Nancy Dow, Division Director of Epidemiology and Public Health Preparedness. So for EPHP, we have tremendously hardworking staff who has accomplished a lot in the past fiscal year. For Division Goal 3.2.1, here we like to highlight our vital statistic program. With our vital program, it's the registrar for all birth and death records in Washoe County. But not only do we provide that essential service of birth and death certificates, we ensure accuracy of information, and the data collected in the registrar supports our statisticians in the creation of various other reports that we produce. And in fiscal year 24, our vital statistics staff processed 52,294 certificates registered, sold, and corrected, all within 96 hours. So even with that large of a volume, we wanted to ensure quick turnarounds of processing to ensure the timeliness of services to our public. And our target in this past fiscal year was to hit 90%, and we definitely exceeded that. We actually hit 100%. And then for our division goal of 3.2.2 of regularly sharing timely public health data and trends with the community, one accomplishment here to highlight is that in our epidemiology program, we continued with our high production of reports to the public. So not including maintaining our dashboards or other portals we provide to the public, we have produced almost 80 reports, which includes various weekly, bi-weekly, monthly, annual communicable disease reports and epi-newses, which are published to ensure health education and awareness for the public, for researchers who use our data, and for our healthcare providers. Also, for our division goal of 3.2.3, which is building the capacity of health district to process data, one key accomplishment that we produced here is that since the late spring of 2023, a data sharing agreement was created between our EMS oversight program with the City of Reno, City of Sparks, Remsa Health, and Truckee Meadows Fire Protection Agency. And this data sharing agreement provided for easier sharing of data between the agencies in order to support needs in quality assurance and any data improvement processes, and also for the program to produce a secure access for the data for our agencies. But the final piece of this agreement required a secure file transport protocol site to be set up, and that took some time because we haven't done that before. And with the support of our Washoe County Technology Services, along with an external vendor, we did have that stand up in February of 2024. And so with this final piece, the agencies are now able to have access to upload or download files securely without any barriers, and for the program to better process data needs. And the next thing I do want to highlight is our division goal of 4.7.1, where we want to here talk about our improving public health emergency preparedness. And this month we do happen to hit, as you guys heard with the proclamation, Public Health Emergency Preparedness Month, and the tremendous work our team does with our coalition, with our healthcare partners, and with various partners in our community. It's a group effort all around. And one of the things that we did very successfully is a full-scale chemical exercise executed in the spring of 2024. Our preparedness program coordinated and hosted a combination of a tabletop and a full-scale exercise over a 2-day period between April 9th and 10th. And the planning process took almost 8 months to complete. And exercises like this serves as a crucial platform always for enhancing collaboration, for refining protocols, and for mitigation the impacts of emergencies within our region. And this one was especially successful with so many participants coming for this, including our emergency response partners, law enforcement, medical examiner's office, healthcare laboratory, our communications team, and a lot of volunteer actors as well. Some of the challenges we did face, one of the themes that you guys have been hearing is about grant reduction. So over the past 5 years, we have seen a reduction in funding with our epidemiology and laboratory capacity program funding that supports our communicable disease activities, as well as our COVID grant funding restrictions that we were made aware of in the beginning of 2024. We had to make quick adjustments too. So we worked really hard to maintain the capacity of our team by shifting staff to other funding sources, such as the SB 118 funds in this coming fiscal year, in order to keep existing county staff, but also severely decreasing our temporary staff support. We are fortunate to really have existing capable staff who are able to adjust to change to support our needs for the community to the best of their abilities. And we have great statisticians who have been working hard to build in more automations to help our processes. Another goal we wanted to highlight that had some challenges we're facing is that we worked really closely with our state and other jurisdiction partners in fiscal year 23 to update our vital records registration system. This new platform definitely will be able to support better real-time interoperability between systems, but with all brand new technology implementation, after the initial launch, there happened to continue to be ongoing tweaks and issues that didn't surface until the implementation actually took place. And our team has continued diligently to support discussions, feedback, and help other partners with the registration system updates as that's ongoing in fiscal year 24. But definitely we do allocate some of our extra time away from our vital statistics to help the process. And then finally, staff turnover does happen in fiscal year 24. Between October of 2023 and February 2024, we had a 4-month gap in our EMS coordinator position as we dealt with turnover. This is a very key position, as you are all aware of, central to the program and a lot of activities. And our EMS oversight program is a very small program. So turnover coverage always becomes a little more difficult with limited capacity in smaller programs because not that many people can cover each other. But our team is always proactive, knowing the burden this can cause. The program has already worked on building more backups, cross-trainings, and worked on building more detailed SOPs for every processes. So, thank you.
There's a lot going on.
There's a ton going on. All right, so now with ODHO, Division Goal 3.1.2, position the health district to be a trusted, reputable source of public health information for our community. Our communications team they've done a tremendous job growing our platform, specifically on social medias. We have now 12,000 followers, which is fantastic. We've also put a focus on accessibility. They've been able to increase accessibility information among our Spanish-speaking communities. We have a Facebook page dedicated for our Spanish-speaking community. We've also focused on modernizing translation on our website. And then our government affairs liaison continues to pull together our stakeholders to identify 2025 legislative priorities. So that is for Division Goal 3.3.1. And some of the other accomplishments that we have, 4.6.2, engage the community in planning for community health improvement with a focus on desperate health outcomes. Our community health improvement plan had an equity focus, so we're really focused on making sure that we're reducing health disparities wherever they exist. And so that's an emphasis. We've been able to achieve over 70% of the initiatives and accomplish those deliverables. For Division Goal 5.2.1, maintain national public health accreditation, one of the last things that we needed to do to pull accreditation over the finish line was to stand our quality improvement program up. I can also say that we also successfully submitted our reaccreditation application, so that's super exciting. Another accomplishment for 5.3.2, increase organizational capacity to address health equity and reduce disparate health outcomes. You just heard a presentation from Camarina on the Health Equity Annual Report, but 92% of those initiatives were achieved in fiscal year '24. Some of the challenges, I think, as all of the division directors have explained, we are focused on increasing dedicated public health funding to support Washoe County. We are continuing to meet with our local, regional, and state partners to determine the best path forward. And with that, we'll take any questions that you might have.
A lot of pieces to that puzzle. Anybody have anything to share? Questions? Go ahead, sir.
Mr. Chair, thank you. First of all, congratulations to all the divisions and the directors, because I think there's a tremendous amount of information being presented. I don't really have a way to engage in each one of them, and so I'll just say I thank each of you for the work that you're doing. I continue to believe that of all the boards I sit on, this one has the most functionally dedicated staff who are working very much on the structural goals of the organization and really taking to heart the planning process that's gone into setting out goals and then measuring them. I don't think that's true for all the boards that I sit on, although sometimes they're measuring them in different ways. So I'm not criticizing those boards. I'm just saying I think from my perspective as an elected, it's easy to see the way in which you are charting the path forward. You are measuring the outcomes periodically and then over the course of a year so that we can make the best decisions. I'll be looking forward to sort of the next agenda item and then our strategic planning discussions that are coming as a result of next year's retreat. And that will really give me the opportunity to take what you presented here today, think about what we're going to do in the next year, and then be really ready for that strategic board retreat. And so it's all just part of the puzzle for me. But again, I really just have to say thank you and tip my hat to all the organization who are working at so many different levels, top to bottom, to make these kind of strategic decisions. So thank you.
Thank you.
Anybody else?
To add to that, I'd like to recognize the board, as this is a process starting back in November 2022, and starting this process, and you guys are very much part of it and help set these guideline stuff. And so this is them feeding back just from your board interaction guidance too, and this is really a great way to show what boards do for our communities and how our elected officials help make decisions and help drive these things, and how we cooperatively work together, both between staff and a board. And I just want to commend the board on that as well. And thank you for that participation in helping setting these strategic goals. And we're happy to come on back and report these positive things. So thank you.
Very good. Well, I'm looking for a motion.
So moved.
I have first.
Second.
A second. Any more discussion? Seeing none, all in favor?
Aye.
Passes unanimously. And we do have one more here, presentation of possible approval of revisions of the FY24, FY26 strategic plan. The only thing I have question on before we begin is what's the difference between this and what we're going to do in what he just mentioned? Because I know I look forward to that as well.
That's a great question. So Brianna Lavoie, Director of Programs and Projects for the Office of the District Health Officer's Office, for the record. The information that you're going to receive now, in your board packet, you have the revisions that we've made to the strategic plan. Those are revisions that we do every year with our divisions to make sure that our strategic plan still makes sense. So some of those activities change because of resources, things happening, the landscape in public health, the public health field. So that's why you have revisions. Those revisions are going to be in fiscal year 25, so moving forward. And then we'll get together for our strategic plan retreat to talk about how we're going to move forward with the next planning cycle for the strategic plan.
Okay. Well, the floor is yours.
So in your board packet, you do have the revisions that were made to the strategic plan. If you have any questions about those, I'm happy to answer those at that time.
Yeah, I didn't have any questions, but I'm prepared to make a motion, Mr. Chair.
Very good.
So move to approve the revisions as presented.
Do I have a second?
Second.
First and second, any more discussion? All in favor?
Aye.
Aye. You guys all ran back there, but I think you're about to run back up here. You trying to get your steps in? I think that's what we're doing here. We're on to staff reports and program updates. I do want to be mindful of the time. I only say that we tend to in our life put aside up to 2 hours. So please keep that in mind as you guys share.
Thank you, Chair, members of the board. I promise this is the last time you'll have
It's
to
all
hear
good.
from me.
Sure, famous last words.
Francisco Vega, Director of the Air Quality Management Division for the record. I think with that said, I don't have anything to really highlight. There was a new version of the Air Now Fire Smoke Map that was updated. And again, that is really a critical resource during wildfire events, so I did want to mention that. We did have one exceedance in August, and that was for ozone, and that was a result of the park fire near Chico in Northern California. I think that's all my updates, so happy to answer any questions.
My only quick question, because I just don't know it, the Davis fire, because it happened here, does that count against us, or is that an extreme event we get to knock out of the air quality?
Thank you for the question. Unfortunately, we don't know yet because we have to wait for the end of the year to see the averaging periods and see if they keep us below the standards and things like that. So while, yes, we did see elevated air quality issues, whether or not the calculations kind of work out and we have to do exceptional events has yet to be determined.
Thank you.
Yep.
Appreciate it.
Thank you.
Okay, moving on to community and clinical health services.
Hi, Lisa Lotters, Division Director for Community and Clinical Health Services. The only update I have for my report is that we will start offering the updated formulations of the COVID vaccine and flu. In the clinic, it'll be available as of, I believe that's Wednesday, October 2nd. So we'll be having those. And then on October 19th, we'll be having a pod event, which we will use, I'm sure Dr. Dow will mention it as well, but as a ICS structure practice, but we use it to provide COVID and flu to our community. So it's a large-scale practice event, but clients can come and get the flu and COVID vaccine as well. And that's going to be from 10 to 12 on October 19th here in Auditorium A and B. And we will be having several other community COVID and flu events, and we'll make sure you get that information. We'll be at some of the mobile harvest sites. We're planning to be at some churches, just different events throughout the community to make sure we get that the COVID and flu vaccine out.
Thank you. Yeah.
Happy to answer any questions.
Any questions?
Just briefly, Mr. Chair, if you
Sure.
mind. Just help me to understand all of those events.
Yes.
Those are free events to the public, or we get reimbursement from insurance or Medicare or Medicaid? How does that work?
So October 19th, that's a great question. So they vary based on those events. October 19th, we're calling it, we don't have to check eligibility, which is a huge bonus for us as far as staffing, because it's very time consuming to do that. So we will not be checking eligibility, so then that is a free event. They won't have to show insurance, and of course, with any of our events, if someone doesn't have insurance or they're underinsured, it is free. Other events, we were given that approval for certain events, October 19th being one of them. I believe the mobile harvests are the same way. Other ones, we do have to check eligibility, and if someone does have insurance, we will bill them. But again, underinsured and uninsured are our priority to make sure they're vaccinated without any charge.
And then how are the services paid for? Are these grants or?
We receive funding, so vaccines for children. We receive vaccine through the state, through Vaccines for Children. And then 317 is 19 and over. So the VFC covers vaccine through the state for the under 19, and then 317 is over. And then we did, it's not completely finalized, receive some funding to help us with under and uninsured for the COVID vaccine. It ranges like about $128 per vaccine. So with that, we did receive some funding, and I think it'll hopefully come to you guys next month for approval, but that will also help us.
And then between all of these events, how many folks are we hoping to vaccinate? And therefore, do we receive like a shipment of the vaccine and it's ready to go?
Yep, I got the word today that all of our funding sources are in, because we were worried it was looking like it was going to be delayed, but we've received all funding sources, and so we're ready to go. And again, we worked it with that one that doesn't come to you till next month, that we'll be able to get the vaccine for the October 19th event. And I know for flu, we have 1,000 doses. COVID, that one, I'm probably around 500, but that is just with the grant. 317 and VFC, that's an addition. So probably close to 1,000 in each that we'll be able to distribute.
And then how will you go about advertising for the various opportunities?
We will work with our fantastic communications team to get a press release out. I actually have a flyer that I was going to give to Dr. Danko today that we're going to distribute to the hospitals to make sure in their emergency rooms they have that. And if someone is there and they're not able to get it that day, they can come here and get it.
Well, it's just such an important thing.
It is.
I know that the further we get from the pandemic and then we sort of shift towards endemic thinking, that people are not as quick to follow health directives. It's like we've forgotten so quickly where we were. And so I'll be interested to see the rollout, and certainly if I can help to be there and promote it. But great work, really good work.
Thank you.
Very good. Any other questions? Okay, thank you. We are moving on to environmental health services.
Environmental Health Services Director, Robert Fida, for the record. I only have a couple items for the board. I wanted the board to be aware that the EPA has actually reached out to some of our staff, and they'll actually be conducting some sampling at private wells near the National Guard Air Force Base. So they're working with staff to kind of identify target areas. EPA is doing sampling for PFAS compounds that they're specifically interested in. So I wanted the board to be aware of that activity is going on. And then the other thing I wanted the board to be also aware about is that staff did found a West Nile positive mosquito in the Del Monte Ranch area. This was mid of August. And we did have 4 suspected positives for West Nile, and they were found at the Wingfield Golf Course and Rio Wrangler areas. Good news is we did do a treatment at the end of the month, a couple weeks after we found those positives, and with the temperatures cooling down, hopefully we will not see any human disease transmission. So our staff is doing some follow-up testing to see if there are additional positives or not, but right now that is, we do have a West Nile positive mosquito pool in the region. So, and after that, I'll open it up for any questions.
Any questions? Yeah, we don't like that.
No.
Thank you. Epidemiology and public health preparedness.
Good afternoon, Mr. Chairman, members of the board. This is Nancy Dow, Division Director of Epidemiology and Public Health Preparedness. And speaking of PAWS, point of dispensing, Ms. Lautra has already highlighted the event upcoming. I would like to highlight here with our pod exercises, it's always more practice, so when actual things does happen and hit us by surprise, we will not be flustered. So in public health preparedness, our team hosted a tabletop exercise on September 10th using a training and exercise simulation tool for point of dispensing designed by the CDC. It's for training emergency and response partners in various roles and responsibilities that they can take on when responding to an incident. So it's almost like a board game that bridges an in-person full exercise and at the same time doing a tabletop. But you get to have stressors put on you and be able to react as things happen. So This tool kind of uses a collaborative game theory and adult learning principles to increase the engagement factor. And with this tabletop exercise, it took place at the offices at the Truckee Meadows Fire Protection District with 20 attendees representing our school district. Central Nevada Health District also came, Quad Counties, CERT, Reno Spark Indian Colony, and obviously our own participants from NMPH and Revive Health Senior Care Management. Great turnout, and we hope to do this more. There's two different types of this board game that's offered from CDC. One is a pod, one is a community reception center, which is after a radiation event, we do need to set up a community reception center to support the public. And in epidemiology, we did publish our 2023 annual communicable disease report that's currently available on our website. In the year of 2023, we have seen a decrease in various disease totals, notably our COVID and RSV as expected. Gonorrhea also did show a decrease, since fluctuations have been also seen in some enteric diseases such as salmonellosis, but nothing significantly alarming at this point, which is good news. We've also set up our new respiratory virus surveillance program page on our district website as we prepare for the respiratory virus season upcoming with our production of weekly reports, which you will find there once we start that week 40, which is the first week of October. Thank you, and happy to answer any questions.
No questions. Thank you so much.
Thank you.
Thank you all. Dr. Kingsley, what you got for us?
Great, thank you. Dr. Kingsley for the record. Just three things to highlight. I'd just like to, as previously mentioned, so with our Public Health Advisory Board, we have submitted for reaccreditation. So that was a big, heavy lift for all of the department and district to be able to accomplish that. So our next is just waiting for them to assign us a site visit to come for our reaccreditation. So again, want to thank staff and directors and everyone that participated in that to help us get us there. We're excited for that, and we submitted a very strong case for reaccreditation. So next is just to acknowledge that the Family Health Festival, one of the four that we have each year, will be on Wednesday 9th, October 9th from 3 to 6 p.m. at O'Brien Middle School in Steed. So again, these are great opportunities. We have the mobile harvest there, but from immunizations, medical, employment, transportation. We're expecting over 100 different families from the area to attend, so just want to acknowledge that again for that, putting that out there, and look for any further information online, but we highly publicize it, so it is there available. And then lastly, just wanted to point out, just as part of it, just as part of it, just in February of 2018, Agenda Item 13 just provided authorization, District Health Officer, to approve changes to fee schedules when it reflects new pharmaceutical or laboratory procedures, and there are just two that I authorized to adjust, but that information is in there. It was just more the bureaucracy we need in order to inform you that that is in there within that. Other than that, the rest is just the report is there for you, and that's it. Thank you.
When accreditation does come around, do we need to be accessible, or is that something staff just does?
Yes, if you'd be able to participate in that, and we'll send out those things and to your availability, but yes, so thank you.
I think I knew that answer too. I just wanted to say it out loud. So, well, thank you so much. I appreciate it. With all of that said, is there any board comments before we go? And I'll say what I think it's on all our heart and mind. Obviously, Dr. Novak is going to be missed, and there's obviously a process that goes through on this, but we'll talk about that another day. Today, we'll keep his flowers in place and his name badge in place. So have a great day. Take care. We're adjourned. 2:56. Woo.